Okay, you've met Barry.
Yes.
How did that go? How did the interview go?
Yeah, good. He's really lovely. He's nice to speak to. But yeah, there's probably a couple of things that I may have missed out as I was going through. But I think I got the main things from the interview.
Okay, so tell me what things that you think you did well to start with, and then tell me what things you think you could have done better.
Okay, so I feel that I sort of got an idea of his main goals at this stage, but I think having read his history, there may have been some more that I could have highlighted a bit more with him.
Yeah.
And just knowing that he's got a supportive family and his life at home and that kind of thing. But I probably could have gone into a bit more detail with that as well.
Okay, so from your interview with Barry and from reading the notes, what do you now want to go on to assess?
Okay, so I'd definitely like to assess his gait.
Yeah.
And just to see how he's walking, how much supervision, or if he's independent with that.
Yep.
Look at the main problems that may be involved with him not walking so well. So therefore I'd like to do, have a look at that and then maybe do an assessment of his lower limbs to test like his sensation and proprioception, see what's involved.
Yep.
Yep.
So tell me first of all, why do you want to look at his gait? Why is that the first thing you want to
I
look
think
at?
because he would like to be independent with a single point stick, to be able to go to the toilet, to be able to walk. So I think for him it's a big part of his treatment goal.
Yep, okay. And we're not going to look at it today, but what else in the bigger picture, what other things would you need to include if you're assessing him in the future?
Yeah, I'd definitely like to do a upper limb assessment as well.
Yep.
I'd like to assess what movement he does have in his right arm at the moment and the quality of that movement, and what kind of things are stopping him from moving and what we can do to help him.
Yep, okay.
Yep.
So let's just go back to the gait assessment then. So you want to first of all look at him walking, is that right?
Yep.
Yep, and then from there, what's your plan?
Okay, so I'd have a look at him walking,
Yep.
sort of make some observations about the way that he's walking
Yep.
and what could be contributing to like the observations that I see, and then from those contributing factors assess what things might be causing him to walk the way he does,
Yep.
and then ultimately try and treat those things that I find.
Okay,
Yep.
all right. And I've just got one more comment, which is that probably if you wanted to go ahead and look at his walking, one of the questions I would have asked him is, why does he feel that he can't walk independently at the moment? So try and get his understanding of why his walking is not safe, or not or that he's not as good as he wants to be, because often the patient will have either a very good understanding of what's going on and can give you some clues, or sometimes they may be way off the mark, in which case you know that you then perhaps need to rediscuss the goals with them.
Yep.
What we might do is actually see Barry walk out in the gym where we've got a bit more space, and maybe if I walk next to him so you can have a look at his gait, and then I'll get you to walk next to him so I can have a look at his gait.
Sure.
And then we'll stop and we'll have a chat about what you then want to do.
All right, great.
Okay?